name is Dr. Mohan Keshavamurthy. Welcome to another edition of Doc Talk. We are here to discuss primary infertility in couples, which is a common problem in India at this point in time. 1 in 7 conceptions are assisted conceptions. I have with me Dr. Suraj Reddy, consultant, Fortis Hospitals Bannerghatta Road. Welcome, Dr. Suraj.
Thank you.
Now, when you have a patient of primary infertility, a couple of primary infertility who have come to you after 2 years of marriage and no conventional method of treatment has helped them, how would you go about planning the way forward to have a conception?
So the first investigation for the male factor infertility, which I'll be discussing upon here, is a semen analysis test. So based on the semen analysis test, we get to know the count, the motility and the morphology of the sperms. So all this put together, we assess what type of issue is there with the semen analysis, and we'll take it forward that way, sir. So there are different problems which we can analyze and depict on a semen analysis report, right from complete absence of sperms, which is called as azoospermia, to problems with the motility of the sperms, which is called as asthenospermia, or there is a combination of asthenospermia with abnormally looking sperms with a poor morphological appearance called as teratospermia as a combination.